Queridos amigos, muy buenos días. Gracias por estar con nosotros en su programa, Café con Leche, la voz de los latinos en América. Estamos transmitiendo desde hermosa 1470 AM, 96.9 FM y también en Facebook Live. Y tengo en el teléfono al doctor Sameh Gadallah. Él es un cardiólogo intervencionista del Antelope Hospital. Good morning, doctor. How are you?
Good morning. Thank you very much. I'm well.
It's a happy Valentine's Day, and
Happy Valentine's Day.
It's a very good day to talk about how can we take care of our heart. I believe so. What are some ways people can keep their heart healthy, please?
Well, before I get into that, let me just emphasize how important it is to talk about heart disease in women.
Mm-hmm.
Most people don't realize that heart disease is actually more serious of a problem in women than it is in men. It is the number one killer in women, more than the next three causes combined.
More than? Could you repeat the last part, please?
More than the next three causes of death in women combined. Heart disease is actually a more common cause of death than the next three causes, which are lung disease, cancer, and accidents. If you combine all these three, heart disease is still more common as a cause of death in women.
Okay, I'm going to translate that, please. Bueno, estamos hablando que es el día del amor y la amistad, y qué mejor que hablar del cuidado de nuestro corazón. Dice, antes que empecemos les quiero decir que es muy importante que sepan que estas enfermedades del corazón son más frecuentes y más serias en las personas. Es la razón por la que se mueren las mujeres más, dice, y más que las otras tres causas de muerte que están juntas, que son los problemas de pulmón, de cáncer y de accidentes. Bueno, el problema del corazón es el número uno por el que las mujeres se mueren. I'm so glad that you are telling us that, doctor. I never heard that before, and now we have to be really careful. Okay, tell us how can we keep our heart healthy.
Okay, but again, before we get to that, there's different varieties of heart disease.
Okay.
The most common type is what we call coronary artery disease, where you get plaque buildup inside the arteries of the heart.
Las enfermedades más frecuentes son las enfermedades de las coronarias, dice, donde se acumula. I'm sorry. Repeat that, please, because I couldn't hear very well. Okay.
Okay. So there are different types of heart disease. When we talk about heart disease, we're not just talking about that in general. The most common type is what we call coronary artery disease, disease of the arteries of the heart.
Okay.
The coronarias.
Okay. Let me translate that, and then I don't forget. Fíjate, las causas más frecuentes de las enfermedades del corazón son, por ejemplo, la enfermedad de la arteria coronaria. Son de las más frecuentes. Now you can continue, please.
Okay, so about almost more than 50% of patients who have heart problems, they have clogged coronary arteries or blockages in the coronary arteries of the heart that can lead to heart attacks and even death.
El 50% de las personas de las mujeres que padecen de las arterias coronarias tienen sus arterias bloqueadas, y bueno, se requiere entonces, dice, eso va a producir la muerte en muchos casos, así es que hay que ser muy cuidadoso. Then, okay, you can continue, please.
Yeah, and so what we need to focus on is how to prevent women from getting this clogged arteries in the heart. And there are certain things we can obviously do to minimize that. So the most common reason for people to get plaque buildup and clogged arteries in the heart are things such as high blood pressure, diabetes, smoking, high cholesterol, and of course there is some family history, racial and genetic predisposition to some of these conditions.
Bueno, entonces las causas más frecuentes de que se tapen las arterias son porque se va a construir ahí una placa, dice, y las causas más comunes es que son personas que tienen la presión arterial alta, que tienen diabetes, que fuman, que tienen el colesterol alto, y dice, por supuesto, también la historia familiar y también la etnicidad, el grupo al que pertenezca. Okay, you can continue.
In general, there are also some ethnic differences. For example, African American women, and Latinas, they tend to have a little bit more heart disease than the Caucasian counterparts. And the main reason for that is lack of awareness of how important heart disease is in women.
Oh, how interesting. Fíjese, dice, hay diferencias étnicas. Generalmente las mujeres afroamericanas y las mujeres latinas tienen más enfermedades del corazón. Dice, y esto sucede debido a la falta, dice, o sea, comparados con las mujeres blancas, a la falta de atención que no le prestamos a nuestras condiciones, porque no sabemos que la enfermedad del corazón puede afectarnos. You can continue now, doctor, please.
Yeah. So they did a study in 2012. They asked a large number of women what they know about how important heart disease is in women, and nearly 60% of Caucasian women said yes, it's important, but only 35% African American women said it was important. Only 32% of Latinas felt it was important. So you can see the gap. And that, of course, translates, if you don't know that your heart disease is important, you're not going to take the precautions necessary to prevent it.
Bueno, hubo una encuesta que se hizo en el año 2012 para saber exactamente cuál era el impacto de las enfermedades del corazón, qué tanto sabía la comunidad. El 60% de la raza blanca contestó que sí era importante, solamente el 35% de las personas afroamericanas contestaron que sí era importante, y nada más 32% de las latinas dijeron que era importante. You know, I think that we had the idea that heart problems was like a man problem more than, because we always hear, oh, he had a heart attack or something.
Yeah, you're absolutely right. As a matter of fact, most women, when you talk to them, they'll tell you, oh, yes, heart disease, mostly middle-aged men, that's what they think. But if you look at all these studies, actually more women have heart disease than men once they go past middle age.
Bueno, le comentaba yo que siempre que muchos creemos, o por lo menos yo creía que era un problema más frecuente en los hombres, porque lo que oigo es, le dio un infarto a esta persona y generalmente es hombre. Dice, sí, por ejemplo, dice, hombres, las mujeres creen que los hombres en la edad media son los que, o sea, como en los 40 son los que van a tener ataques al corazón.
And not only that, even healthcare professionals, they tend not to take women's complaints seriously. So if a woman, let us say a middle-aged woman, shows up in the hospital with chest pain, she would not be taken as seriously as a middle-aged man. And as a result, many women go to the hospital with heart attacks and they get missed. They're not diagnosed quickly enough.
Wow. Fíjese, dice, este problema incluso ocurre con los profesionales del cuidado de la salud, que le dan menos importancia a las quejas de las mujeres no toman muy serio lo que está pasando, dice, de tal manera que van al hospital y a veces fallecen porque no se les dio la atención adecuada, porque no se consideró que era tan urgente como cuando un hombre de edad media, de edad mediana, en los 40, llega a un hospital. Wow.
So many years ago, the American Heart Association started this campaign to try and increase the awareness amongst women of how serious heart disease is. That's why we're doing this interview. That's why we have this Wear Red Week once a year. We didn't do it for the past couple of years because of the pandemic, but now we're renewing our activities to try and restart that campaign. But the whole thing is geared towards making women understand that they are also subject seriously to having serious problems of heart disease, and if they have any issues, any concerns, they should seek help and they have to be more assertive about it.
Dice, hace algún tiempo la Asociación del Corazón hizo una campaña para atraernos a que prestemos atención a este problema de salud en las mujeres. Entonces debemos de entender, y para que ellas entiendan en general, que este es un problema muy serio. Dice, es por eso que estamos el día de hoy en este programa, y también dice, no hemos hecho en los últimos 2 años por el COVID este evento de hacernos saber de los problemas de corazón para las mujeres por el COVID, pero estamos renovando. Doctor, even, do you know, I can see that we have all the high risk, the Latinas, because we have hypertension, we have high blood pressure, hypertension, high blood sugar, and overweight. It's almost, I don't know, but a bigger percentage of Latinas, we have that kind of problems, no?
I totally agree. We see a large number in our practice, and it's a general observation that Hispanic women, Latinas, tend to be less active. They tend to stay home and take care of the family. You're right, they tend to be a little bit more overweight, a little bit less in shape, and they don't exercise routinely. Many of them have some diabetic issues, high blood pressure issues, and of course cholesterol. So they do have all the risk factors, and they don't seem to realize how important it is.
Bueno, dice, efectivamente la mayoría de las mujeres latinas, dice, son menos activas porque se dedican mucho al cuidado de la familia, tienen exceso de peso, son diabéticas, tienen la presión alta y también colesterol, y todos esos son factores que van a incidir en un problema de corazón. Doctor, we are going to take a little break and we will be back, okay?
Sure.
Thank you. ¿Le puedes subir al volumen, por favor? 3 veces como el mejor abogado del Valle del Antílope. Así que si sales lastimado en cualquier tipo de accidente, solo llámale al 661-945-5300 y él ganará su caso. Y si no gana, no le debes nada. No esperes más. 661-945-5300, 661-945-5300. Ángelo Campano, el abogado en quien la comunidad confía. Queridos amigos, muy buenos días. Gracias por estar con nosotros en su programa Café con Leche, la voz de los latinos en América. Estamos transmitiendo desde Hermosa 1470 96.9 FM y también estamos en Facebook Live, y tenemos al doctor Sameh Gadallah. Él es un cardiólogo intervencionista del Antelope Hospital, y en este mes del corazón, del Valentine's Day, nos está hablando de cómo las mujeres latinas, afroamericanas, estamos en mucho mayor riesgo que anybody else, porque no sabemos de la importancia del problema del corazón, que produce muerte y es la causa número 1 de muerte en mujeres. Así es que, okay, doctor, let's continue, please. I am so interested because, even though I am...
I understand, but before we go into how to get things better, let me just explain one important difference between how men men and women present with heart disease.
Okay.
Most men, when they're having a heart attack, they will have chest pain or chest pressure. Most women don't. They come in different forms. Shortness of breath, weakness, fatigue, sleep disturbance, back pain. So the majority of women who are having heart problems do not present in the classic way of, oh, my chest is hurting. They actually present in a very different way from men.
So interesting. Dice, la diferencia entre un infarto o un problema de corazón en hombre es que ellos van a venir de inmediato con dolor en el pecho y también presión en el pecho, y inmediatamente se le identifica como un problema de corazón, un infarto. Sin embargo, la mujer va a venir con síntomas diferentes, va a presentar, por ejemplo, que no puede respirar bien, o que tiene cansancio, o otra diferente patología que puede confundirse con otra enfermedad. Then how do my doctor can know that it's a heart problem, doctor?
Because they have to keep a high index of suspicion. When women show up in the hospital with any of these symptoms, fatigue, shortness of breath, lightheadedness, back pain, doctors always have to suspect that they might be in the middle of having a heart attack, because now we realize that most women do not have the classic presentation of chest pain. So doctors have to be very, very suspicious, and women have to be proactive about it. You should say, well, how do you know it's not my heart? That sort of thing.
Oh, very good. Bueno, le estaba yo preguntando, entonces, ¿cómo hacemos que nuestro doctor ponga atención? Dice, porque el doctor debe estar sospechoso si hay nuevamente, si no puede respirar bien, si hay, tiene, ¿cómo se dice? Como la cabeza ligera, como mareada, si tiene dolor en la espalda. Cualquiera pues, de estas patologías van a hacer sospechar, el doctor debe sospechar de un problema de corazón, pero nosotros también debemos de preguntar, doctor, ¿puede checar mi corazón? So if you can ask, for example, if I don't see that my doctor is finding or doing anything, I just ask, please check my heart?
Yes, and we have so many examples. When we did our actual symposium once a year before COVID, we used to have women who had been through this experience come to the meeting and actually share their stories with the audience. And I distinctly remember one of them who kept going to her doctor, kept going to the emergency room with neck pain, back pain, and they kept sending her home. And it wasn't until one of the blood tests came back showing a heart attack that she was taken seriously. Then we ended up having to take her to the operating room and do surgery and all these things. For months she's been running around complaining of symptoms, but she was not taken seriously.
Cuando tenían los eventos para hacer a las personas atentas a que el problema de corazón en mujeres es una realidad y un problema de gran magnitud, dice, hacíamos conferencias donde personas que habían padecido este tipo de problema, pues me iban a hablar. Dice, por ejemplo, llegó una paciente que dice que se estuvo quejando por mucho tiempo de dolor en el cuello, dolor en la espalda, y no, siempre le decían, o sea, no había ningún seguimiento, hasta que finalmente una vez en un examen de sangre presentó que tenía un ataque cardíaco. Es hasta ese momento que se le dio atención, pero se estuvo por mucho tiempo ignorando el problema. Wow.
Okay, well, in the last few minutes, let me talk about how we can maybe take care of our hearts. Now, the first question you asked me is how can we take care of the heart? But I just want to make sure that we understand what we're dealing with. So the first thing we have to realize that some families have genetic tendency to have heart disease. It runs in the family. And people should be aware of that. Women who, their dad, their mom, their brother, sister, have heart attacks at a young age should be very, very aware that could happen to them too.
Do you know my sister died with a heart problem, and I just went to check my heart because I I was thinking, do you know, I felt something almost nothing, but I just want to be sure because my mind is telling me go to the doctor. So I came to the doctor.
Absolutely, you did the right thing.
Okay, fíjense, hay una tendencia genética que no debemos ignorar. Si tenemos familia que ha padecido el corazón, su mamá, su papá, sus hermanos que han padecido del corazón, este es un problema que se debe checar y debe de pedir a su doctor que le cheque. Estaba yo platicando que yo tuve un pequeño incidente y decidí ir al doctor a pesar de que generalmente hubiera dicho, ay, no es nada, pero porque mi hermana me acordé y fui al doctor y pedí que me hicieran mis exámenes. Okay, doctor, you can continue. Do you know this is really great the information that you are giving us. Thank you so much.
I appreciate it. Just a few more things. So genetic predisposition or genetic history or whatever, that unfortunately we just can't do anything about it. But there are several things we can do to try and prevent heart disease. These are what we call changeable or modifiable factors, such as cholesterol, diabetes, high blood pressure, smoking, physical inactivity, being overweight. These are the things that we can do something about.
Bueno, dice, en las cuestiones genéticas, pues desafortunadamente no se puede hacer nada, ¿verdad? Pero hay otros factores que podemos modificar, que podemos cambiar y que entonces van a influir en mejorar nuestra salud. ¿Y qué es? Otra vez, el hacer ejercicio, el controlar el colesterol, el controlar la presión arterial, también ¿qué otro? Doctor, do you speak Spanish?
A very little, not enough to.
Oh.
Not enough
Okay, no, because I was
my,
wondering if you think that I am doing not fine, because sometimes they don't tell me and I am translating and I am concerned. No, but then if you pay attention, if you are overweight and you stop smoking, that is going to be two good things that you can do for yourself, no?
Yeah, absolutely. So, unfortunately, we live in a society now where this fast food is all over the place, and unfortunately, people have become a little bit complacent about their health. A lot of people eat fast food, hamburgers, a lot of animal protein. So we have to be very, very careful with our diet. We have to eat more fruit and vegetables, less red meat, less animal products, butter, cheese, and we should eat more vegetables and more legumes, fish. These are the things that will lower your cholesterol and improve your health in general.
Bueno, el problema que el doctor nos está diciendo es que desafortunadamente estamos viviendo en un momento donde la comida rápida, la fast food, es lo que nos está arruinando, porque mucha gente se ha vuelto muy complaciente y consume solamente ese tipo de comida, o en su mayor parte ese tipo de comida, y si debemos definitivamente de cambiar de las hamburguesas y de todo lo que ya se come preparado, a preparar nuestra propia comida y hacer énfasis en el consumo de las frutas, las verduras, las legumbres, y dejar de comer un poco de carne roja también. Así es que tenemos que tener una dieta más saludable. Okay, doctor, you can continue, please.
Yeah, okay. So the other thing, of course, is high blood pressure. A lot of people don't know that they have hypertension because it doesn't cause any symptoms. People could be running around with a very, very high blood pressure and they're not aware of it. That's why they call it the silent killer. Mm-hmm. So how do we detect it? You have to see your doctor periodically. You have to see a healthcare provider, have your blood pressure checked periodically. And it's a good idea to buy one of those machines. They're about $50 or so from the drugstore, and maybe periodically check your blood pressure.
Okay. Otro de los factores muy importantes, dice, es la presión arterial. Generalmente las gentes no saben que tienen su presión arterial alta. Entonces van por ahí porque la presión alta no presenta ningún síntoma. Por eso se le llama el asesino silencioso, porque te mata y ni te diste cuenta de qué es. Así es que dice, Yo lo que le recomiendo es que vaya a su doctor periódicamente, se cheque su presión. También puede comprarse en la farmacia un aparato para usted mismo medirse su presión arterial y tener control. Doctor, but why? What is the cause of the high blood pressure? What do we do to? Is there any other way to?
In many cases, it's genetic. It runs in the family, but also things just like being overweight, eating excess salt, drinking alcohol, physical inactivity. All these things will raise the blood pressure.
Le preguntaba yo cuáles son las causas de la presión arterial alta. Dice, bueno, generalmente va a ser el sobrepeso, el consumir alimentos con exceso de sal, el tomar alcohol y el de no hacer ejercicio. Así es que podemos controlar. Then we really can control all of them.
Well, I mean, it has to be when you see your doctor periodically, maybe 3 times a year or so. They always check your blood pressure, do some blood work to look at it, measure your cholesterol, check your sugar, and so these routine visits that a lot of people don't do are very important because they tell us what is happening with the patient's health in general, and that's how we discover things like diabetes, high blood pressure, high cholesterol, and of course things like cancer by mammograms, colonoscopy. So, I mean, people tend to downplay the importance of going to the doctor's office periodically, but it's important because it's like taking your car for routine maintenance to check on things, otherwise you end up with a problem.
Bueno, estamos hablando de todas estas situaciones que se producen cuando tiene uno un problema. Dice, generalmente cuando vas al doctor, ahí te hacen tu chequeo. Dice, generalmente mucha gente no considera importante ir a checarse con el doctor. Y por eso es como un carro que no lo llevas a su servicio, ¿verdad? Ahí en el servicio se detecta todos los problemas, iguales con las personas. Doctor, look, the time is gone, but I would be a pleasure to have you again, because it's information so important, and the way in which you expose it, it was so great, and also, we need a lot more of this. Just because many of the Latinos don't have medical insurance and they don't have access to, they go for an emergency case only. Maybe we can...
Yeah, that's a good point. But again, just before I finish, there's so many ways that so many things we can do ourselves. We all know what healthy diet is. We all know that physical activity and exercise is important. We all know how bad smoking is. Yes, it's important to go to the doctor, but even if we have no access to that, we can still do a few things to be proactive and take care of our health.
Okay, doctor, thank you so much. The time is gone. Hasta la vista. It was a pleasure to have you. Gracias.
Thank you for having me. Thank you. All right. Bye.
Dijo que aunque no vayamos al doctor, todavía tenemos la posibilidad de comer mejor, de mejorar nuestra alimentación, de hacer ejercicios, de dejar de fumar y de bajar de peso. Todo eso es lo que necesitamos hacer para que podamos tener control en el problema de corazón y no lo echemos en saco roto, amigos. Las estadísticas hablan. Entonces, les agradezco mucho que hayan estado con nosotros y el día de mañana todo va a estar perfecto, ¿eh? Así es que hay que tomar cartas en el asunto. Cuídense su corazón. Hasta mañana, babies. Bye bye. Otra vez no pasó.